Thank you all for coming to this forum. I've been asked to tell our experience about farmers in the field of food-borne diseases. So to my knowledge, the problem of our farmers is from these 3 days, I understand that there are two main problems of our farmers with regard to resilience to the food-borne diseases. The first is knowledge, and the second is initiative. I would like to share with you about the research conducted by the Ministry of Agriculture that has indicated that unsafety of poultry and dairy products in Indonesia is caused by several factors, among others the knowledge level of farmers about contamination and infection processes, and then the practice of farmers to cleaning cage, and the practice of farmers to prepare the feed, and also less awareness of farmers towards the importance of sanitation. There are the main problems that cause the foodborne diseases from the farm level. In poultry and dairy farming, the poor of enclosure sanitation has caused microbial contamination of unwanted pathogens like E. coli, etc. I'm not such an expert of that field, but it is at least information that we learn from the research center. And in fruits and vegetable farming, contamination coming from sewage, irrigation water that coming from the industrial sectors, contaminated soil, and most of us using animal dung as fertilizer. So from that material, most of the foodborne diseases coming from. My observation as the organizer of farmers community, to decrease foodborne diseases coming from the farm, we should focus on preventing contamination at the production, harvesting, and post-harvesting stages. So that are the field that we have to prevent the contamination. There should be a well coordination between sectors, government, actors, farmers organizations, NGOs, individuals, the rural leaders, to organize and to increase the knowledge of the farmers with regard to their way in the production sector. And there should be an organization from national as well as national to do the responsibility for implementing the monitoring. It is also important understanding differential local exposure, in helping farmers. Understanding differential local exposure is the key. Is the key to helping farmers to build their self-help ability. But there is opportunities to build the resilience of the farmers from the ground activity context. extension services that generated by local government and could be farmers organization, NGOs, could play a great role to inform farmers about diseases that caused by food or products that they produce. And maybe some recommendation that we could raise from these discussions, kind of a thematic research that could be done maybe by the research center or by the international organization. Like, firstly, in what kind of incentive could be or should be applied for farmers who applying good farming practices. There should be an incentive. And secondly, what kind of local policy should be developed and or implemented in order to control the production process on farm, particularly when farmers using sewage irrigation water, animal dung for their fertilizer. And how far is the farmer's knowledge towards the contamination process on food that they produce? Number 4, what are the external intervention and or enabling environment could be developed from the perspective of the social capital of the community in order to build their own resilience? That kind of thematic research maybe could be done by the sectors. And I'm trying to formulate policy recommendations. My first recommendation is a policy to developing capacity of farmers' organizations as an agent for raising its members' awareness about food-borne diseases and enhance their ability to train members to apply good farming practices, as well as good handling practices. I think it is one of solutions to be built at the local for the local community resilience. And at the government level, implementing a monitoring and regulating system of food production in order to lower contamination and infection caused by farming practices is an immediate policy actions. There are 2 policy recommendations that we are trying to raise in this discussion. But the most things that I think is very important with regard to our members, farmers, is how we transfer the knowledge from the research, from the scientists, from the governments, to the ground level. That is the most important things. The knowledge that very important to prevent the food-borne diseases caused by the method of the practice of farmers in doing production in the field. My time is off, then thank you.
Thank you very much, Agustin.